Okay, hello everyone, and welcome to today's IR Connect lecture. I know we had a bit of a pause last week, but we're getting started back again just for the final few lectures, really focusing on sustainability, scale up, iterative learning, policy to action. And so this is how we'll end our series over the next few lectures. As you come in, please remember that we do have translated, translated captions available. And so if you prefer to receive today's lecture in a language other than English, you can receive translated captions. Just make sure, that you select the speaking language of English and then the captioning language of your choice. All right, so today our topic is presented by Dr. Housseini Dolo. And Housseini is an associate professor of epidemiology at the Faculty of Medicine in Bamako, Mali. And today's lecture is on study design and methods with a specific focus on sustainability and scale up. If you have any questions throughout the session, please do post them in the chat. And Housseini, let me know, do you want to try to take questions as we go or hold them all until the end?
I think we can keep them for the end of the session so that we can discuss.
That's fine. We'll keep them for the end. So, make sure you post your questions in the chat just so that you don't lose them. And then we'll talk about them at the end. And so with that, thank you so much for joining us today, Housseini, and over to you.
Okay, thank you, Anna, for giving me this opportunity to present uh, for during this series of lectures on implementation research. My today lecture is on the implementation outcome, effectively integrate the concept of sustainability in implementation research study design. During this, our objective for this session is to describe the concept of sustainability and sustainment, and to describe the importance and the rationale of integrating sustainability concept into implementation research design. It will be split in two sections. The first section will be about the concept of sustainability and sustainment and its importance to incorporate in the implementation research design. What's the concept of sustainability and sustainment and in implementation research design? Implementation research aims to improve the implementation of intervention. Ideally, implementer, beneficiary, and other stakeholders might desire that the effect of the intervention will be available for a long time to maximize the benefit for the community, depending on the type of intervention and the health problem it addresses. At this point, the importance of mapping the stakeholder linked to the evidence-based intervention is very important. The sustainability is the extent to which an evidence-based intervention can deliver its intended benefit over an extended period after external support from the donor agency is terminated, meaning that when we are thinking about the sustainability, we are at the end of the project. The donor support is terminated. Most of the public health intervention in resource limited setting are supported by the donor, and this is very important for us to think how to keep sustainability. Sustainability in the short term is defined as a sustained benefits. Sustainment is the continued enactment of processes, practice, or work routine that are convened and learned through an intervention or sustained use of that intervention. We can resume to say that it's the continuous utilization of the intervention. According to Green, the sustainability covers domain of both sustained benefit or use, including the institutionalization of intervention in the existing organizational system and community capacity to support and optimize benefit from the implementation of the intervention. Meaning that here we have the ancient, we have also the community participation, which is very important. Multidimensional sustainability covers combination of sustainability and sustainment at the community, service, and governance level. More and all also define sustainability has 5 interrelated constructs, including time, continuous delivery, behavior change among implementer and beneficiaries, evolution and adaptation, and continued benefit. You say that here for the concept, there is several definitions, meaning that the definition of sustainability and sustainment is not very easy. There is some factor that influence the sustainability and sustainment of intervention that we are implementing in the ground. The intervention design and implementation can influence the leadership and the organizational setting of the implementer and other contextual factors, including the community participation, the socio-economic and political situation, which is also important. And the sustainability and sustainment of intervention have been central issue in public health. Improvement loss is a phenomenon that frequently happens after the public health project program period is over, meaning that it's terminated. Improvement in practice and public health impact made during the project period is significantly diminished or lost once the project ends. This can be due to the demotivation of the staff, the lack of continuing education, and etc. Many things can happen after the termination of the project. This calls for systematic planning from the outset of the project in addressing the importance of sustainability and the sustainment of public health intervention. Meaning that before you start the project, you have to think about the sustainability and the sustainment of the intervention that you want to construct or implement. Implementation and research design used in public health should incorporate sustainability and sustainment planning and assessment as critical components. For example, current implementation research in Kulon Progo district in Yogyakarta province in Indonesia assesses the sustainability of the Zero TB project. The Zero TB project is a pilot of comprehensive screening of TB and provision of TB prevention treatment. The project has shown promising effectiveness after 3 years of implementation. The implementation research uses a framework to assess the potential and barrier to sustainability. And we look at, they are using the X-ray. This is a mobile X-ray that is used in the field. The findings can be used to facilitate the process of integration of the Zero TB project into the national TB program. Now, if the project ends, how to sustain the active TB case finding after the project? I say that normally the X-ray test is in the health centers, but in the project they are using the mobile one. How they will, after the project, be able to sustain this active case finding using the same intervention material. After this first section in the concept, we will look at the approach to integrating sustainability, sustainment concept into the implementation research design. Two systematic approach for, there is several frameworks to assess or integrate the sustainability and sustainment in the implementation research design. But two systematic approaches for integrating system will be looked at here. Firstly, the implementation research design should incorporate sustainability, sustainment, framework, especially for planning and designing and implementation research project. When you are thinking of the planning and the design, you have to think about the different framework that you want to use. The expand net framework from WHO, we reach effectiveness, adoption and implementation maintenance framework known as REAIM framework can be also used. The program sustainability assessment tool, PSAT, can be used, and the consolidated framework for sustainability, the sustainability of public health intervention, which is somehow, the PST is somehow, and the capacity for sustainability framework also can be used in the design and planning. If we look at the historical framework in sustainability, we can look at the expand net framework first. The different domain you can see for the sustainability is the innovation, the user organization, the environment, the resource, the team organization, and the scaling up strategy. If you want to use this framework, you can use during the design, the development, the implementation, and the evaluation of the public health intervention. After this one, we have the REAIM. The REAIM domain is the reach, the effectiveness, the adoption, the implementation, and the maintenance. You can use this framework to assess some aspect of sustainability and sustainment. You have the program in sustainability assessment tool, the PSAT. The domain is the political support, the funding, stability, the partnership, the organizational capacity, the program evaluation, the program adaptation, the communication, and the strategic planning. You can use this also for the assessment of the sustainability and sustainment. The next is the consolidated framework for sustainability construct in healthcare. The initiative design, the negotiating initiative processes, the people involved, the resources, the organization setting, and the external environment. Can look at this as the domain of the framework. And for the use, you can use for the design, the development, the implementation, the evaluation of the public health intervention. The next is used for the prediction, the sustainability for public health intervention. The domain include is the planning for sustainability, the gathering, the evidence, seeking commitment and support, the engagement of and partnership, the program champion, the building capacity, the organizational and community embedded into core policy, evaluation, evolve and adapt, and founding. Then you can use this when you want to predict for the sustainability and sustainment. The capacity for sustainability framework, this is the domain is the funding stability, the political support, the partnership, the organizational capacity, program adaptation, program evaluation, communication, public health impact, and strategic planning. You can use this framework to create shared understanding among stakeholders and also for the assessment. This one is the expanded net for the World Health Organization, how to scaling up, the scaling up framework. And you have here the environment where you have the innovation, the resource team, the user organization, and this will make the element of scaling up. And during the strategic choice area, you can look at the different type of scaling up, the dissemination and advocacy, the organizational processes, the cost and resources mobilization, the monitoring and evaluation. And this framework was used to evaluate the results and evaluation of the expansion of a model of comprehensive care for Chaga disease within the national health system, the Bolivian Chaga network. They started with vertical program first, and then they tried to extend this to a number of health centers before looking at scaling up.
I'm sorry, Professor Dolo. This is Mahnaz.
Yeah.
Can you please adjust your camera? Because it's we only see from your it's not adjusted, and I think there is a light behind you which is not good. So yeah, please adjust it properly so that we can see you properly. Thank you.
It's good now?
It's good now. Thank you so much.
Okay.
Please proceed.
Okay. And this was the first, the expanded net framework. And the second is the consolidated framework for sustainability. This will look at different also things. The initiative design, you have the negotiating initiative processes, the people involved, you have to look at the resources, the organizational setting, the external environment. If you take the demonstrating effectiveness, you can look at the belief in the initiative. For the people involved, you have to look at the stakeholder participation, the general resources, the integrating with existing program and policies, and for the external environment, you can look at the socioeconomic and political consideration. When you want to make the monitoring the progress over time, you have for the negotiating initiative, accountability for role and responsibility. You can look at the leadership and champions and the founding. The organizational setting will focus on the intervention, adaptation, and the receptivity, and the external environment will focus on the awareness and raising the profile. And you can also look at in terms of expertise for the negotiating initiative processes, we workload, the staff, the people, the staff involved, and for the resource and time allocation, and support available from the organization setting. The problem, the complexity, the ownership, and the opposition. And the project tip, if there is, for the people, if there is a kind of satisfaction. We have another framework, which is the RAIM framework. The RAIM, or the goal of the RAIM is to encourage program planner, evaluator, reader of journal, article founder, and policymaker to pay more attention to essential program elements, including external validity that can improve the sustainability adoption and implementation of effective, generalizable, and evidence-based intervention. The 5 steps to translate research into action are the target population, how many population you can target with your intervention, looking the different level, provider or implementer. You have the effectiveness or efficacy, the adoption by target staff, setting, system, and community, the implementation consistency, cost adaptation made during the delivery, the maintenance, sustainment of intervention effect in individual and setting over time. And for this, there is a paper from Collins which use this framework to look at the prioritization of evidence-based and evidence-informed intervention for the retention in medical care for persons with HIV. The PST tool is another tool which is somehow new and is assessing the sustainability capacity of evidence-based program in community and health setting. They they work with many stakeholders to look at the evidence of using this framework to assess the sustainability and to evaluate health public health intervention. Assessment and process for developing a sustainable project. You have to look at the assessment of developing a sustainable project. You have to think about the funding stability, the political support, the partnership that you are making, the organizational capacity, the program adaptation, the program evaluation, the communication, the public health impact, and the strategic planning. The framework that can explain certain processes that are essential to predict the level of sustainment will focus on the planning for sustainability, the gathering of the evidence, the seeking commitment and support, the engagement and partnership, the program champions to look at in the grant the individual and the or the individual who can make the leadership, the building capacity, the organizational and community, and embedded into core policy evaluation and evolve and adapt and the founding. How now to measure the sustainability system and its context factors. This is the second strategy to address sustainability sustainment. The implementation outcome and hypotheses in systemic studies can differ among 6 types of intervention. Those interventions include the intervention implemented by individual provider, the intervention requiring coordination among multiple staff, more complex and new policy procedure and technologies, the capacity or infrastructure building, and the collaborative partnership of coalition. If you look at one by one, the intervention implemented by individual provider, they have to think to look at how to measure the fidelity. Fidelity is the measurement of system at the provider level. The assessment should include the contextual factor of fidelity, including motivation to continue the practice and intensity. The intervention requiring coordination among multiple staff, the sustainability assessment should focus on the effort of different stakeholders in implementing the intervention and later the sustainability. The first will be the effort to focus on the effort of different stakeholders. The assessment should focus on the effort of the different stakeholders in implementing. And after you will think for the system. In this type of intervention, the adoption is the implementation outcome real level to assess. The implementation of new policies, procedure, and technologies. The adoption of the implementer to existing health system should be the focus of assessment. It should also include the continuous effort to monitor and enforce the implementation of new policies, procedures, technologies. The assessment of systemic for the intervention of capacity or infrastructure building, they should address on the sustaining capacity of infrastructure building, the evaluation of political and financial support to the implementation organization should be addressed. If intervention is collaborative, partnership, or coalition, the sustainability assessment should cover the commitment of the coalition partnership to continue working together and founding the activity in the partnership. The partner perception of the value of their partnership and possibly also include the potential changes in the broader scale system in the period of 10 to 20 years in advance. Before we finish this lecture, we can ask a number of, we have a quiz that we will try to answer for the sustainability. One, sustainability reflects on how the plan of intervention have been implemented in the real setting. Is this true or false? How many people in this group think that this is true or false? You can maybe open your audio and then maybe make a kind of quote so that we can. Okay, the second question, based on the expand net framework, sustainability will depend on the environment of scaling up strategy. And the second is based on the expand net framework, sustainability will depend on only resources and innovation. So the first is false, the second is true, and the last is false. Here is the answers. One is false, second is true, and the third is false. And this is now the references that you can read to understand this presentation. And thank you for your listening. Question, please.
Okay, thank you so much. Please, can you fix your camera again? Thank you. Great. Thank you so much for giving this presentation. Are there any comment or questions? Let me check the chat box. Anna, thank you so much for putting all the reference documents. Any hands up?
No problem. I maybe I just want to point to the document that's in the
Sure.
chat, because it is a recent systematic review of how sustainability has been measured, looking at it at both as an outcome and as a determinant. And maybe I have a question, Manaz, if it's okay. Can I jump in?
Yes, please. You can ask a question and you can answer a question as well.
Well, let's see. I mean, the question that I have was actually related to the quiz, Professor Dolo, and the first bit about sustainability reflecting how an intervention was implemented in a setting. And you know, one of the examples that you provided about how sustainability could be measured at the provider level was around fidelity, right? Which is that idea of how an intervention is implemented. So can we talk a little bit about maybe why that answer is false, but why we might also look at fidelity as a measure of sustainability?
Yes, for the fidelity, you have normally the fidelity will look at how the intervention is implemented as it was planned. And for the fidelity, you have to look at the provider level in your staff, how many persons are implementing the intervention as it was designed.
Yes, can I jump in?
Yeah, go ahead.
In terms of sustainability, my understanding is that if fidelity could, in some instances, be a measure of sustainability, but at some level, it actually, you might need to make changes, but if these changes to scale up the intervention are accepted by the programs or community later on, they can still be sustainable. I think it depends on the situation, in my opinion. For example, for the scaling up of antiretrovirals or integrating of the, TB treatment with diabetes, with diabetic care, then if you can actually see how the research that you're doing, or in terms of a scaling up, you need to perhaps, it may not be very fiddle in terms of the design, but if the uptake is accepted in future by the providers or people who receive the care, then it can become scalable. but I think it takes a lot of effort and energy, and all the stakeholders need to agree in general. Am I clear or am I right, Anna and Housseini? I'm just
Very
talking
clear.
from experience.
Yes, it's the comment is clear. It's the measuring the fidelity. Sometimes it's difficult because you have many stakeholders in the program also.
Yeah, exactly. Yeah. Now, there's a question, Dr. Housseini, that can you go back to that slide with the questions?
Okay.
Can you put it up, please?
Yes, I will.
And the question is, why the first option is not correct? It's from Ganga Marasini.
Yeah, one moment. Sustainability reflects on how the plan of intervention have been implemented in the real setting. This cannot be only this cannot only reflect the sustainability, because you have another factor that influence the sustainability is not only the plan on how the intervention have been implemented in the setting. You have also to look at in terms of how many people are adopting your intervention, are adopting, and also how many institutions, if it's a different institution that have to implement your intervention, how many institutions accept to implement this. This is why discussion cannot be only focused on the real setting only. For this question too, based on expand net framework, sustainability will depend on the environment of scaling up strategy. Because if you want to look at the sustainability, you have coming back to this part of the presentation. You look at here, if you look at the expand net framework, you have the environment, you have the innovation, the resource, the user, and the organization. We have to take all these parameters into account for.
Yes. So it's a combination of different factors that will will work towards that. So it's not just one. Yeah.
And the third is that based on the expand net framework, sustainability will depend on only resource and innovation. Even if you have the resource and the innovation, and then the people do not accept, or the community do not accept your intervention, then it will not be sustainable.
Exactly. Okay. There any other questions, colleagues?
Hi.
Yes, really.
Yes.
Can you introduce yourself briefly and tell us where you're coming from?
Coming from Uganda.
Okay, great.
Yeah.
And your question?
I am coming with my question. First and foremost, thanks for the impactful presentation. Having that one said, I think I just needed clarification on sustainability. I think if we are going to say the answer is false, I think it means then we need to phrase this question maybe to have maybe an element, or we say maybe the only plan for intervention that have been implemented in real setting. Because when we go to the previous slide, there is a section which was looking at the implementers themselves, where they are actual, where if you are measuring sustainability, then you need to focus on fidelity as the implementation outcome to measure measure sustainability. So in relation to that, I think, to me also, if that question is the way that it right now, we can still say it is also correct. It is true.
Correct. I agree
Before,
with you.
I mean, after this, yeah.
Yeah.
For you, vacation one is true.
Yes, for me, if the way you frame the question stands, then it is also true, because we say there is a slide, yes, one where you are to focus on it, where you are to focus on before this, where you are on the implementer, but focus on fidelity as the measure of stability. So in relation to that, if the question, because here is plan, how the plan of intervention has been implemented in that setting.
Yeah, but they said sustainability reflect on how the plan of intervention have been implemented in the real setting. You are focusing on the fidelity. It's not only the fidelity that can be used to measure the sustainability. There is another factor.
I agree, Doc. Yes, I agree. The other factors. That's why I'm saying, if we make the question like that,
exactly.
If we make,
yeah. I agree.
The question should be sustainability only reflects on how the plan of intervention have been implemented in real setting.
Yes.
Then
it falls.
Yeah, I agree.
Then,
you are correct. Yeah, you are correct. We will change this.
Yeah, thank you.
Yeah.
Yeah.
Okay. It seems that there is no more questions. So let's join me, colleagues. If you have your camera, put the camera on, since there's only 20 of us here, and we should thank our presenter today. And I really appreciate if you can also assess this lecture and the presentation. That would be a good way for us to improve on our work. Really, thank you. You already touched base on the question in the quiz. We will try to fix that. Otherwise, if there is no more question or comment, I will thank Professor Housseini. And Anna, do you have any comment or question?
No, I mean, also to give my thanks to Professor Dolo. Thank you so much for joining us today. And to say that next week at the same time, we'll be hearing from Dr. Humara Binte Anwar, and we'll be talking about iterative and learning cycles to facilitate continuous improvement of implementation research. So we hope you can join us all again next week.
Great. Thank you so much, Anna, for organizing. And thanks to colleagues in IR Connect. And again, thank you all for joining this session, and looking forward to seeing you all next week.